Hi, my name's Teresa. I'm from Ottawa, Ontario, Canada, and I'd like to take a few minutes to tell you about my experience with HyProCure. The HyProCure procedure is one that corrects flat feet, and I had it done on both feet in the summer of 2012. The results have been remarkable, and I couldn't be happier with what my feet can do these days. The result is better than I could have ever hoped for. If you don't know already, HyProCure, it's a titanium stent that's put in between some ankle bones in your foot, and when the surgery's done, you have an immediate solution and a permanent solution to your flat feet. Now, when I heard that, I thought it sounded too good to be true and was quite skeptical. I asked my doctor about it and my chiropractor. Neither one of them had heard anything about it, and the most they would say about it, well, it sounds interesting. So that left me on my own to look at through what I could find on the internet. I looked at lots of studies and lots of websites of doctors who did the surgery. I was lucky enough to find the website of Dr. Anthony Weinert in Detroit, Michigan, who is an award-winning podiatrist and surgeon. I didn't know they gave awards for that, but apparently they do, and he has them. At my one-on-one consultation, he was able to show me a moving x-ray of my foot and how the bones worked, and compared that to how the bones work in the foot of someone who has a natural arch. When I saw that, I understood immediately why my orthotics didn't work and would never work. And it was at the point for me when I saw Dr. Weinert that I couldn't wear the same shoes 2 or 3 days in a row. I'd have to switch it up because the pain points were becoming unbearable, and I'd have to start walking with a limp. So I'd rotate my shoes out and was pretty much resigned to the fact that I'd have this pain in my feet forever, and the associated knee pain and back pain as well. As far as the future, what I thought my future held was larger bunions and more difficulty in finding shoes that were not comfortable, just bearable. This is a picture of my mom's feet. This is her bunion. I don't know where she shops for her shoes, but if I didn't have the surgery, I'd be looking for shoes that would fit a bunion that size. I did have the surgery. I went ahead with it. At age 53, I wasn't too old to have it, which was a pleasant surprise. The surgery itself was minimally invasive, 45 minutes under local anesthetic. I left with my foot in a large tensor wrap. I know some doctors do a boot or a walking cast or a leg brace even, but Dr. Weinert just did the tensor wrap. I used crutches for the first bit, and then just gradually it got better and better. I had my last surgery at the middle of August, and this fall I was not able to take really long walks, but walking was fine. I was able to take an aquafit class and start some work on an elliptical machine. This winter I could not do cross-country skiing, but I was able to snowshoe and start yoga, so that was great. And now this spring I'm looking forward to going ahead and doing all the activities that I normally do, but this time I will not be looking at how to find shoes that fit orthotics and my ever-growing bunions, because I don't need them anymore, and my bunion has corrected a bit and it's no longer painful. It's not the thing I think about when I put my shoes on. So to wrap it up, the surgery, the results have been just amazing. If you want to have a better idea of what it looks like to have an implant and not have an implant, my daughter also had the surgery last year, and she did a video showing her before and after feet, and she put them on YouTube. So if you look under Cassie's feet on YouTube, you'll be able to see what that looks like and hear her comments about her experience with HyProCure. So all in all, my life has changed. I did not realize how painful my feet were until the pain wasn't there anymore. And if you are having similar issues, I strongly recommend that you take a look into HyProCure, and don't be afraid. It's not a gimmick. It actually does work, and it could change your life too. Thanks, and I hope I helped answering some questions that you may have.